Hello viewers, welcome back to the Medical Board Exam Experience with Dr. Kofu. Today, our country of discussion is Uganda. We have with us Dr. Matovu Gustavus, who is an international medical graduate of Uganda Medical University in China. He has successfully passed the Uganda Medical Board Exams and has joined us today to share with us his experience on how to study and prepare for these exams. Let us join Dr. Gustavus in our discussion room. Thank you.
Viewers, on this channel, I interview doctors who have successfully passed or failed any medical board exams to share their exam preparation experience with us and with all those preparing to write theirs. I encourage anyone watching me at this moment to kindly subscribe to this channel and also recommend this channel to any medical student or medical doctor who is preparing to write the board exams of any country. If you have experience with the board exams of any country and would like to share with us, kindly reach out to me on my Facebook page, Instagram, or leave a comment at the comment section under this video and I'll keep in touch. Who is qualified to take the Uganda Medical Board Exams?
So the medical licensing exam in Uganda is known as MLAB, which stands for Medical Licensure Examination Board, and it has to be written by any foreign trained doctor that wants to work in Uganda, be it foreign or Ugandan, who doesn't meet the criteria of registering in other pathways. Or actually, we do have two other pathways, and I can briefly take you through them. So yeah, the pathways are the direct registration, which is for doctors, foreign or Ugandan, that have trained in East African community countries or anywhere else in the world and have a year of experience and they are registered, or for doctors that are registered in the Grade 8 countries, the English-speaking Grade 8 countries. Then there is the peer review. This peer review is for Ugandan citizens that have trained from outside East Africa but have the evidence of completing an internship from the country they've been training in, or East African citizens who have trained in other countries outside East Africa but are registered in that country although they don't have experience, like in their mother country. Yes. So MLAB is for those people that don't meet the above criteria. If you are any person that doesn't have the above mentioned criteria, then you have to write the MLAB, Ugandan or foreign.
After your graduation, how long did it take you to prepare for these exams?
So after my graduation, I don't know how I'm going to put this. It took me about 5 months to prepare for the exam. I started, I think, it took me roughly 5 months to prepare for the exam. And in terms of hours, I can't remember the hours because actually I had an elective training, so I could go during the day to the hospital. And then when I came back at home, I started doing some studying, maybe from 7 to 12, and from 7 to 12, so roughly those many hours.
The exam is taken in how many languages?
Our exam is only in one language, English. There's no other language you can write the exam in.
What is the registration process for the exams?
Registering for the exam, well, the process is not that long, though it requires you to have your documents in order, because you'll have to apply to the NCHE, which stands for the National Council of Higher Education, to verify your documents. And then there, the Secretariat will shortlist those people that have documents that are required to write the exam. They will make a shortlist, and then they will have an interview. After the interview, you'll be informed when and where the exam will take place, and they will give you a prescribed fee where you go and pay. I think for foreigners it's about $500, and then for Ugandans it's about $200. Yeah, where you go and have to pay that money, and then after you pay the money, you take this receipt back and you submit it, and then they will let you know of your exam date and time.
The exam is in how many sections?
So this exam has 2 sections. Section number 1 is the theory exam, and section number 2 is the clinical exam, or OSCEs, whichever you prefer to call it.
What is the content and duration of each section?
So each section, let me say, so the theory, which is going to be section number 1, is going to be for 3 hours. That consists four papers: internal medicine, pediatrics, obstetrics and gynecology, and lastly surgery. And then the OSCEs, well, the OSCEs, I don't know how, I think it's about an hour to 2, because each station is about 5 to 10 minutes. 5 to 10 minutes, not more than 10 minutes per station. So the exam assesses, like I said earlier, it assesses only the clinical skill, the clinical subjects: internal medicine, surgery, pediatrics, obstetrics and gynecology. Although there is change, and maybe later it may assess the public health and also some basic sciences, but as for now, it only assesses the clinical subjects.
Did you attend any special classes?
So the exam, I didn't attend any special classes, because at that time when I wrote the exam, there was no any reliable material, and there was the East African community thing, so there was a lot of changes trying to standardize the exam to assess doctors to be able to practice in East Africa, anywhere in East Africa. So there was no special classes, but right now there are a lot of people that have written the exam, and they are offering help if you need it.
Did you take any practice assessment test before the exams?
I think the practice assessment before the exam has been answered above. Like I said, there's a lot of changes, so there is not really any information out there online that you can assess yourself, or a book or something. So you just have to prepare well, and yeah, go for the exam and try your luck.
What about question banks?
So question banks as per se, there are no question banks, but there are past papers, and they're available once you register for the exam. You'll find your fellow colleagues and your seniors. You can ask them, and they can help you with the past papers. So yeah, there's no question bank, but you can get past papers.
How is the exam scored?
So the exam is scored individually. Each paper you have to pass with 50%. Actually, before you go for clinical skills, you need to pass the theory with the 50% in each individual exam, although you write your exams at the same time. Yeah, you'll have 3 hours to do all your 4 papers, but you need to get 50% in each paper individually. And then once you pass that, you go to clinical skills, whereby you have about 4 to 5 stations per department. Pediatrics, you have 4 to 5, obs and gyn, you have 4 to 5, each about 5 to 10 minutes. And even there, you still have to pass individually, yeah, to get a 50%, and then you've qualified.
How many times can one attempt the exams?
Okay, someone can only attempt 4 times. You can only attempt 4 times, and after the 4th time, unfortunately, you can't attempt anymore. And if you want to attempt the exam again, you'll have to choose a medical school of your choice here in Uganda, and then you go back and have some training, maybe for 1 or 2 years, and then you can qualify to write the exam again. Otherwise, after 4 times, it's unfortunate and very difficult to rewrite the exam. Maybe you could appeal appeal if you're dissatisfied dissatisfied with your results. You appeal to the registrar of UMDPC, and maybe your results can be checked, and hopefully you can pass after they're checked.
Can the exams be taken outside Uganda?
The exam cannot be taken in any country, actually, unfortunately. It has only to be taken here. You have to come to Uganda to take the exam. But the pros are that if you pass this exam and you finish your registration process, you can work anywhere in the 5 East African countries, and you qualify to work in any of the 5 East African countries.
What will you do different if you are to prepare for these exams again?
What I'll do differently, let me see. Maybe I'll try to have more clinical practice, because actually when you think about it, our exam, it's easy to pass the theory, but many people get stuck on the clinical skills. They're very challenging, and what I'll do differently is I'll get more elective time, rotate in the hospital, and get more hands-on, and prepare more thoroughly for the clinical skills, because they're very challenging. You're going to get live patients with actual diseases that you may have not seen or seen before, but you really cannot differentiate. So I would probably practice more.
What books or resources did you use for this exam preparation?
The books I used for theory exam, I used the Oxford Handbook, and then also the other main books for each individual subject. For Obs and Gyn, I used for Obs and Gyn, I used Blueprint. For pediatrics, I used Nelson's. And then for surgery, I used Bailey and Love. And for clinical skills, I used Hutchinson's. And also, of course, you need to read the Uganda clinical guidelines. They're very important to know, like what the first line treatment here is. And of course, for clinical skills, you also need to watch some OSCE videos online.
What are your final words for anyone planning to take these exams?
Final words. My final words are, the exam is doable, though challenging. So once you finish your theory exam, don't relax that you've passed, because actually, unfortunately, for our exam, after you write your theory exams, you have like about just 2 days, and then you do your clinical skills. So you won't have enough time, so you have to prepare nicely for clinical skills. So once you pass your theory exams, don't relax. Go back to the hospital, practice as much as possible, ask your seniors to help you, show you the most common cases for OSCEs. And once you really practice enough, you can make it. The exam is challenging, but it's doable.
Thank you for your time, Doctor.
Okay, thank you too.